What if the future of rural healthcare hinges on a political showdown you've barely heard of? Dr. Mehmet Oz, the high-profile administrator of the U.S. Centers for Medicare and Medicaid Services, recently made headlines in Atlanta by defending federal healthcare policies and hinting at a major recruitment push for federal workers. But here's where it gets controversial. His comments clash with growing concerns that recent Trump-era legislation is starving rural hospitals of critical funding. Let's break it down. At the Health Connect South Conference in Atlanta, Oz painted a rosy picture of the Trump administration's healthcare agenda, calling federal workers superstars and urging attendees to apply for open roles. "If you don't come, you're going to regret it for the rest of your life," he declared. A line that's as bold as it is polarizing. But not everyone's buying it. Critics argue that while Oz touts federal hiring, the same administration's budget cuts are leaving rural communities scrambling to keep their doors open. The crux of the debate? The so-called One Big Beautiful Bill Act, a sweeping Trump proposal that aims to streamline healthcare spending. Oz insists this bill will bring hope to rural areas by redirecting funds to innovative programs. Yet detractors point to data. A 2025 analysis shows rural healthcare spending has dropped by 15% since the bill's inception, with 511 hospitals in small towns now at risk of closure. This is the part most people miss, says one insider. The bill's supporters claim it's about efficiency, but in practice, it's a funding game of musical chairs for struggling clinics. Numbers back this up. The Centers for Medicare and Medicaid Services, CMS, reported a $731 million shortfall in rural healthcare grants this year alone. Oz defended the cuts, arguing that streamlining bureaucracy will free up resources for high-impact projects. But rural physicians tell a different story. "We're being asked to do more with less," says Dr. Sarah Mitchell, a clinic director in Georgia. "If we lose another 15% of our budget, we'll have to stop treating diabetes and heart disease, conditions that define rural health care." The administration's push for privatization adds fuel to the fire. By shifting $5 billion in rural healthcare funding to private insurers, the Trump team claims to empower patients. Yet critics warn this could exacerbate disparities, as smaller hospitals struggle to compete with corporate giants. It's a gamble with real lives on the line, says healthcare analyst Michael Chen. Will this create a leaner system or push rural America into a healthcare desert? So where does this leave the average American? Oz's team insists the new policies will turbocharge innovation, pointing to pilot programs in telemedicine and mobile clinics. But for communities already stretched thin, the stakes feel much higher. As the debate rages on, one question lingers. Do you think these cuts will cripple rural communities or streamline services for better efficiency? Share your thoughts below, because when it comes to healthcare, there are no easy answers.